Namaskar, madam. I'm Dr. Sujata Mittal, working as senior Gyne Oncologist, that is cancer specialist, lifestyle medicine expert, functional medicine expert, and plant-based nutritionist since last 30 to 35 years in Delhi. Madam, I congratulate you for your first Parliament speech, which was really precise and in the welfare of the whole India and our community. We are very much worried about the health of our young girls, and you have pushed the drive of the government of India, that is to vaccinate our all girls. But madam, here I am going to highlight certain adverse effects and what this vaccination drive is going to cause to you, because as a layman, as a common man, you might not be aware of the scientific evidence and the research. Madam, if you are going to push and if we are going to vaccinate our all girls with HPV, just like COVID, we are going to have lot of problems in our young girls. So coming to the scientific facts, madam, as you told, definitely cervical cancer is the second leading cause of cancer in our country. But you, at the same time, you said that it is caused by the HPV infection. Madam, there are two types of the HPV infection. One is the sexually transmitted and another is non-sexually transmitted. Whosoever becomes sexually transmitted, whosoever becomes sexually active, this infection gets entry into that, because this virus is commonly present in the males. Only when it enters a female body, and if it persists for many years, let me repeat it, madam, if it persists for many years, then it can cause a cervical cancer. Only under exceptional conditions, that is when the immunity is not good or immunity is low. So government of India and neither you have highlighted these problems. This is that as per research, this HPV infection gets cleared automatically by the age of 26. That is why the screening is asked to start by age of 26 years. Only under certain circumstances, and what are these circumstances, madam? And the latest research has already shown, including ICMR, that oral contraceptives, they increases the risk of cervical cancer. That has not been highlighted. So madam, one thing I want to highlight and tell you, that oral contraceptive, early sexual activity, they are combined thing and have become a major problem in our country. Our girls, just like the West, have started having sexual activity at a very young age, and they want to hide this all these things from their family, so they start on their own taking the oral contraceptives. And madam, oral contraceptive pills are freely and easily available in the government hospitals and the medical colleges. Beside these two, that is early sexual contact and oral contraceptives, unhealthy or the sanitation conditions, smoking, alcohol, all these things, they also causes the loss of immunity or decreased immunity, and hence this infection can persist for a longer time. Madam, if this infection persists for 10 to 15 to 25 to 30 years, then only it can cause the cervical cancer. It doesn't cause directly cervical cancer, madam, per se. It causes precancerous lesion, which if treated in time can then the cervical cancer can be prevented. So, madam, another latest research which was done by Dr. Sean Damry, 2023, which says that the HPV, that is human papilloma virus, present in our body as a commensal, as a natural infection, as a natural virus, that is called commensal in the skin, prevents the skin cancer. So what does Dr. Damry says? He says it is not beta HPV that encourages squamous cell carcinoma in immunocompromised individual. Instead, it is the loss of the immune function that increases the risk of squamous cell carcinoma. The role of these commensal viruses in this case, that is the papilloma virus, is to induce immunity. Then it is protecting patients from the skin cancer. So madam, I want to tell you the same thing is happening with the HPV, which is sexually transmitted. There are certain questions which are not being answered yet by the science, or they are hidden from the public. That is, what about the serum antibodies which are produced by natural infection? Definitely, madam, once anyone gets infected with the HPV, whether it is a sexually transmitted HPV or routine non-sexually transmitted, the body makes the antibodies against them. Do they provide protection after reinfection with the same type of the HPV? The science is silent on this. And then another important thing, suppose the antibodies are being produced by the body, okay, and our test is not able to detect. This means, what does this mean? This means that the DNA negative state represents complete virological clearance or immunological control of infection below detection limits of the current HPV assays. And madam, another important thing is that it is not being highlighted at all that in spite of getting HPV vaccination, you need to get the screening done. Another point here, side by side, which I will arise is that HPV vaccination doesn't prevent all sort of the infections. As per the studies and the research, there are 14 types of the high risk HPV or 14 types of the oncogenic HPV which can cause the cervical cancer. Madam, Indian Indian vaccine, which is being produced by the Serum Institute of India, that is Sarvarec, that contains only two types, that is 16 and 18. For 6 and 11, that are that they cause warts. So, and Gardasil, which is produced by the Merck, Gardasil 9, that only contains 7 types. So, madam, rest of the oncogenic HPV, they are not being covered. Still, patient can get the infection from them. Madam, according to research and studies, 70% of the cervical cancers, they can be caused by the HPV 16. Remaining 10% is caused by HPV 18, and remaining 3% are caused by the other oncogenic HPV. So in totality, 80 to 83% of the cancers are caused, cervical cancer are caused by the oncogenic HPV. Remaining 27, they are non-HPV type of the infection. So madam, what about all those infections? This Gardasil or Sarvarec is not against remaining high risk or the oncogenic HPV infection. And then I am talking about the screening. Madam, what happens to screening? Has the government told the public that in spite of getting the vaccine, you need to go for the screening in government offices? Madam, let me draw your attention to very, very important fact that in trials done in 2000, between 2000 and 2009, when public outroar was done in Andhra, Gujarat, where in Andhra and Gujarat, tribal girls were vaccinated without proper consent and without screening facilities and even without gynecologists. Till date, has PATH or Bills and Melinda Gates Foundation has done the screening on those girls, and the reports available? Madam, we want those reports available. Another important thing, madam, the rates of the cervical cancer as per the ICMR also, as per the epidemiological studies, is already falling. In an RTI reply for 2019 to 20, in Maharashtra, 68 lakhs women were screened and 25 lakhs were only below the age of 30. Only 65 positive cervical cancers were detected, that is a percentage of 0.0001. Since it is already declining without any proper screening or vaccination, I want to understand why the government want and you want to push this drive for the HPV vaccination when the HPV vaccine is not covering all the high oncogenic or the high risk oncogenic viruses. Further, madam, for the Serum Institute made Sarvarec. In phase 2 and 3 trials of Sarvarec, the follow-up was only for 220 days, madam, only 220 days after the vaccination. The long-term efficacy and the protection by the virus is not known. So how do you know efficacy will last as long as the cervical cancer? How do you know? How do we know that the efficacy will last till the cervical cancer develop? Because cervical cancer develops by the age of mostly 80% of the cases beyond the age of 40-45. So do you think it it is advisable to vaccinate our girls at the age of 9, 10, 11, 12, because as the cervical cancer will develop after almost 25 to 30 to 35 years. And do you think, madam, the immunity antibodies for which these companies are making false claims will persist at that time? Still, people are not, doctors are not clear how many doses, one doses, two doses, three doses, or after some time they will say that you need more doses. So, madam, how many times we are going to push? Madam, another important fact which I would like to draw attention is that the Sarvarak summary of product characteristic, that the product inserts 4.6 states fertility. On the studies on the fertility, no human studies have been done. Pregnancy or trying to be pregnant, not to be given. And for the lactating mothers, no data is available on the excreted milk of the humans. Why this vaccine is given if there is no data and trials for the above things? Because I am seeing that lot of doctors are giving postpartum leave. Even they are giving in the pregnancy also. So, madam, just like COVID, I think in the coming years this is going to bombard, and it is going to destroy the future of our girls, madam. Just like, and another important thing, very very important, madam, which you should pay attention, and the government of India should also pay attention, is that there's a paper published in general regarding the increased incidence of cervical cancer after the HPV vaccination, and this paper had to be retracted because the researcher was afraid of the big pharma. We all know, madam, how the big farmers are, how they are pushing their agendas for the money making. In COVID, I think everything is, must have been very clear to government also, to the people also, and to the parliament, whole parliament also. Then, madam, in phase second and third trials, 1% severe adverse reactions were reported in both boys and girls, and that is the reason Government of India has acknowledged these severe side effects and has not included this vaccine in the Universal Immunization Program. Why the details of these severe life-threatening side effects are not publicized as per the judgment of the High Court dated 15/1/2019, madam. Madam, in USA, compensation are giving for is given, and there are a lot of lawsuits against HPV vaccination. What is the provision? What is the provision for the compensation in our country regarding this vaccination if the side effects occur? Please, madam, let us know the compensation clauses in case side effects arises, and where to put our compensation, where to put our complaints, because the website started by the government regarding the AEFI, that is the for the during the time of COVID, it was not very active. Not all AEFI could be reported. And madam, if we are giving to the girls in the villages, they don't have access to to the computers or to the websites. Another important thing is that the Sarvarek summary of the product characteristic 4.4 states the following may not result. It states, madam, that it might not result in the protection in all the recipients. Even in the Gardasil 9, madam, insert, it is written it might not protect against cancer in all the recipients. It is for the prophylactic use only. That means there is no guarantee, madam, that you will be protected. Then why you want to give this vaccine, madam? Why this important point is not publicized also? This is very very important thing, that those who are receiving informed consent, proper information regarding the screening, and that it might not be protecting against cancer, and all, not all type of the high risk cancers are covered, all these points, plus your immunity. If your health is good, you're not using OCs, you're not sexually active before the age of 18, you're not smoking, you're not alcoholic, plus your sanitation conditions are good, plus you are not malnourished, these will control your infection. And because this infection will definitely come once you are sexually active. Another important thing is, if you look at the product summary of the product characteristic 5.1 states That is regarding the immune response, madam. The minimum anti-HPV titer that confirms protective efficacy has not been established. What does this mean, madam? What is the use of this vaccine? That is, what are the titers still? At what titer? At, that the amount of the antibody will protect against the cervical cancer, that is not mentioned, madam. So these are very, very important and pertinent questions. I will go on, can go on for hour, 1 hour, madam, pointing towards the problems with the this vaccination. But here I am, because I want to be precise like you, so I am pointing the highlights only. 5.1 also states that Cervarix has been evaluated in randomized controlled clinical trials and has demonstrated immunogenicity against licensed quadrivalent vaccine. Madam, in randomized control trials, always the control is not another vaccine. It is always innocuous, that is the water for injection. Why Cervarix was compared with Gardasil? Why? What does they have just with the they've just bypassed every clinical trial, even for the Gardasil also. I'm not saying for the Cervarix. They've done whatever they wanted to do. They have tested in the controls. It should be water for injection, that is normal saline. But they have tested against the Gardasil. Gardasil is produced by the Merck. So this is not actual randomized control trials, madam. And this is called the fooling the public for the profit. And this is called fooling the public for the profit. And till date, Government of India has not taken any action against the Bill and Melinda Gates Foundation, and they have been doing lot of research, lot of studies along with ICMR and AIMS. Dr. Nirja Bhatla has done lot of studies, and Dr. Partha Basu, they have done lot of studies with this BMGF Foundation, that is Bill and Melinda Gates Foundation and PATH, in spite of the fact that have flouted all the norms in 2002, 2009. So, madam, I request you to reconsider this vaccination drive for the young girls, because just like COVID, again I am emphasizing, it is going to be cause lot of uproar and lot of problems to the government, and definitely not to the problems, our girls will be the suffering. We know now clearly that because of the COVID vaccine, lot of young deaths are occurring. And one thing personally which I have noted, madam, that this vaccine brings about the neurological changes. It causes the autoimmune disorders, plus somehow it affects the brain in such that I've seen the package inserts of Gardasil 9 and Cervarix. Somehow the incidents of the drowning, suicidal tendencies, motor vehicle accidents are found in these package inserts as a side effects. I've not seen all these typical these sort of the deaths, and they are writing that this is not related to the vaccine per se. So again, madam, I request you to withdraw this as a drive and put hold on this. We should be researching more. We should be taking more opinions regarding this vaccine, because it is going to do a lot harm. Thank you, madam.